Hello students, in today's tutorial we'll be learning about reproductive health. Reproductive health is chapter number 4 of unit 1st of your book. So let's just start. Now the first thing that comes into the mind is a question that what do you mean by a reproductive health? So my students, according to the WHO, which is known as World Health Organization, the complete well-being with respect to all the aspects of the reproductive system is known as a reproductive health. And those aspects are physical aspect, emotional aspect, social aspect, as well as behavioral aspect. A person showing all the aspects working well is the person who is considered as a reproductively healthy person. Now students, you know that the main problem of India is its excess population, which is directly connected to the reproductive health. So to achieve a total reproductive health, some plans and some programs were started. India was the first country to launch a program which was named as a family planning program. This program was started in the year 1951. Later, some modifications were made, some rules were changed into this program, and it was named as Reproductive Child Health Care Program. The basic motive of both the programs was same, that was to create a reproductively healthy society. So let us now discuss about the problems which are related to the reproductive health. The first problem is lack of awareness. People are not aware about the reproductive system. They are not aware about the working of the reproductive system. They are not aware about the uncontrolled population growth and what are the drawbacks, what are the ill effects of the larger population. People also don't know, they are also not aware about the latest techniques and the government schemes that government has proposed to create a reproductively healthy society. And this is the reason, this lack of awareness is a reason for our second point of problem, which is population explosion. Now, students, what do you mean by population explosion? Population explosion is basically the tremendous or uncontrolled increase in the rate of population, in the rate of growth of population. This is known as population explosion. The third point that comes under the category is myths and misconceptions about the reproductive aspects. In village areas, we must have seen that village people sometimes, not sometimes, most of the times, they relate these reproductive aspects with their mythologies or some of their local knowledge, which is not correct, which ultimately harm the reproductive health. And this is why the myths and the misconceptions about the reproductive aspect is a major problem which is related to the reproductive health. The fourth point is illegal abortions and female feticide. The killing of fetus, whether male or female, is illegal. We all know this, that killing is illegal. It is a criminal activity. So illegal abortion as well as female feticide, both are a major problem which is rising in the society and is ultimately affecting the reproductive health. The fifth point is STDs, which is sexually transmitted diseases. This we'll be learning in part second of this chapter. After talking about the problems which are related to the reproductive health, let us now study about the strategies one can implement for improving the reproductive health. The first point is create awareness. Now, awareness about what? awareness about STDs, which are sexually transmitted diseases, about contraceptives. Contraceptives are the birth controlling devices or the methods. A fertile couple and people of marriageable age should know about the availability of the birth control devices, the contraception, care of pregnant mothers, postnatal, which is after birth, care of mother and a child, the importance of breastfeeding, and equal importance of male and female child. The third point is menstruation. We all know about menstruation. You must have seen that there is a certain time in a month when females are not allowed to enter the kitchen, the temple, because of this process. Because the society considered this process as impure, which is wrong. This is a normal process, just like digestion, breathing, respiration, excretion. This is also a normal process which happens into a female body and which is very, very necessary for giving birth to a child. So, menstruation should be treated normally, but in our Indian society, it is a major problem which need a proper implementation of some strategy to fight with this myth. The fourth point is ART, which is the assisted reproductive technology. These are the techniques and technologies which allow the couple with low birth possibility to have a kid. Now, the second point, the second strategy that we'll be discussing is educate the people. There are various governmental as well as non-governmental associations which are working in villages to educate the people through Anganwadis, through street plays. They are working to educate the local people about their reproductive health, about the working of their reproductive system. Education of people as well as education of students is very important. Now, how you will educate the students about it? So, sex education in school should be introduced and encouraged to provide right to information about the myths and the misconceptions which are related to the sex related aspects. Now, how can we educate? Now, what are the other sources through which we can educate the people? So, with the help of audio visuals and print media, which is very important. With the help of audiovisual as well as print media, the governmental and the non-governmental agencies are taking various steps to create the awareness among the people about the reproduction related aspects. The other aspects are, the other sources are parents, other close relatives, teachers, and friends. They also have a major role in dissemination of the above information. Now, the third point is, the third strategy is by increasing the marriageable age. Now, in present time, the marriageable age for boys is 21 years and for girls it is 18 years. By increasing this marriageable age, we can easily monitor the reproductive health. The fourth point is by acquainting people about the ill effects of the larger population. Now, what are the ill effects of the larger population? If there will be a sudden increase in the population, then there will be no food, there will be no space, there will be no jobs, and resource exploitation, of course. So, there are n number of ill effects of the large population. So, for successful action plans to attain the reproductive health requires good infrastructure of structural facilities as well as professional expert knowledge and material support. This we all know. These are some necessities to provide medical help and care for reproductive health related problems like menstrual problems, infertility, pregnancy, delivery, contraception, abortion, STDs, and implementation of better technique and new strategies are also required to provide the better care and to help people for the reproductive health. So these are all the strategies that are for improving the reproductive health.
Now, before learning about population explosion, we need to understand some terms which are demography and census. Now, what is demography? Demography is the statistical study, that is the mathematical study based on data analysis. The statistical study of human population. And census is the procedure of collecting that data. That means the procedure of systematically collecting the information about the human population. Now students, census is conducted in every 10 years. First one was done in 1871. That means after a gap of 10 years, again the census will be conducted. That was in the year 1881. The latest was done in 2011, which was 15th census, and according to that, the population was 1.2 billion. Now, the data was given in 2011, but the data that was given is updated in the second year also. That means if a data is given in 2011, then in 2012 certain data will also be provided, and that will be the approximate data. You getting my point? Now, according to this data, in the year 1900 the world population was 2 billion. But in the year 2000 it crossed 6 billion. Can you see the difference? And in 2001 it crossed 7 billion. This tremendous increase in the population, this tremendous increase in the data is known as population explosion. Now, am I clear with the term? Now students, according to the latest information, the most populated state in India is UP, and the least populated state in India is Sikkim. The recent census was done in the year 2011, and it projected that the total population in India is about 1.2 billion. And the population, the doubling time of the population in 2011, it was 30 years. But when the census was done in 2001, earlier than 2011, the population doubling time was 33 years. Now what is the doubling time? Doubling time is the time in which the population will get doubled of the recent number. Abhi, for example, the number is 1.2 billion. Getting my point? Now it will get doubled and it will become 2.4 billion. This reduction in the doubling time, can you see the reduction data? In 2001 the doubling time was 33 years, but it used in the year 2011. According to it, the doubling time will be 30 years. So this reduction in the doubling time was due to the rapid increase in the population, and this was termed as population explosion. Am I clear? The population explosion is due to the decrease in the doubling time and increase in the growth of population. The number of population is growing tremendously, because of which population explosion is faced. Earlier we discussed about population explosion. But I want to add a point here that according to the family program, they have started a slogan which named Hum Do Hamare Do. And because of this, the birth rate decreased. If the birth rate is decreasing, then why the population is increasing? Why population explosion is there? So, students, the population explosion birth rate is not the alone criteria which is increasing the population. Okay, so it is a myth. The population is increasing, yeah, the explosion in population is experienced because of the declining of the death rate, because of the rapid declining of the maternal mortality rate, MMR. Earlier we were not having such medical facilities, we were not expert hands, and because of that we were facing a lot of maternal mortality rate. Many mothers were dying due to deliveries or post deliveries, so that is also decreased. There is a rapid decline in the infant mortality rate. The female feticide is stopped. Illegal abortions are stopped. They are treated as a criminal activity. So, because of the rapid declining of the infant mortality rate, population is increasing. The increased life expectancy due to the better medical condition, the better medical facilities is also adding up as a point. The fifth point is better living conditions. We are in a better living conditions, a suitable environment, and because of that, we are facing no loss. The sixth point is increase in the number of people in the reproducible age. Now, we all know that population is increasing, but we need certain preventions for this population explosion. So what will be the kind of preventions that we can give? What will be the measures that we can take to control the population? The first one is people, particularly those in the reproducible age, should be educated about the advantages of the small families. Second point is rising the marriageable age is more effective means to control the population. Now the marriageable age, we all know that for females it is 18 years and for male it is 21 years. By increasing it, we can easily monitor the reproduction. And the third point is by using contraceptive methods, that are the birth control methods, we can control it. We can control the population explosion.
So students, let us now study about contraceptives. That what are contraceptives? The prevention of pregnancy is known as contraception, and the methods and the agents which are used for contraception is known as contraceptives. So basically, the contraceptive methods are the preventive methods to help the woman to avoid unwanted pregnancies. Now the question is that what is an ideal contraceptive? Which contraceptive is considered as an ideal contraceptive? So the contraceptive that is easily available, easy to use, which is effective, which is having no side effects, as well as which is reversible is considered as a ideal contraceptive. Now there are certain methods of contraception. There are 6 type of methods which we consider as methods of contraception. The first method is natural or traditional method. Second one is barrier method. Third one is IUDs, which is the intrauterine devices. Fourth is oral contraceptives. Fifth is injectables and implants. Sixth is surgical method. Let us now discuss about the first method of contraception, which is known as the natural method. Now, as the name tells itself, natural method only involves the physiological aspects. That means there is no outer thing which is used as a contraceptive or contraception. Natural method includes periodic abstinence. Now, what is periodic abstinence? It is one such method in which the couple avoid or abstain from coitus from day 10th to day 17th of the menstrual cycle when the ovulation could be expected. Now, as we all know that after ovulation, the egg will be there in the fallopian tube only for 2 days. And if during these 2 days, if the egg will not be fertilized by the sperm, it will get degenerate. That means there would be no pregnancy. So, as the chances of fertilization are very high during this period, the period of 10th to 17th day. So, this period is known as the fertile period of the menstrual cycle. Therefore, by abstaining the coitus during this period, conception could be prevented. The second one is withdrawal or coitus interruptus, which involves the withdrawal of the penis by the male before the ejaculation so that semen is not deposited in the vagina and there will be no fertilization. The third one is lactational amenorrhea, which means the method that is based on the fact that there is no menstrual cycle and therefore there is no ovulation does not occur during the intense lactational following by parturitional period. That means there will be no ovulation during the lactation period. However, this method is effectively working only up to maximum period of 6 months. That means this method will be valid only till 6 months period. Now, in natural method, when we are not using any sort of medicines or devices, the chances of side effect is very low, but the chances of failure is very high.
Let us now study about the barrier methods. In these methods, the sperm and the ovum are prevented from coming closer with the help of some barriers. We are using some outsider source which is stopping the fertilization and it do not allow the sperm and the ovum to meet and undergo fertilization to form the zygote. These methods are available for both males and females. Now, the first method is condoms. Condoms are the barriers that are made up of thin rubber latex sheath to cover the erect penis in the male and the cervix in the female just before the coitus so that the ejaculated semen would not enter the female reproductive tract. This can prevent the conception. Nirodh is the popular brand of condom for males. Condoms also have an additional benefit of protecting the user from STDs and AIDS. These are sexually transmitted diseases which transmit through some sexual contact. Condoms are disposable and can be self-inserted, and because of this, they keep certain privacy for the user. The second point is reusable barriers such as diaphragms, cervical cups, and walls. These are the rubber covers that are fitted in the cervix of the female vagina, which blocks the entry of the sperm into the uterus. They are also reusable. The third point is spermicidal creams, jellies, and foams. Now, as the name tells itself, spermicidal, the one that can kill the sperm. These are usually used alongside. These are the barriers to increase the contraceptive efficiency. That means they are used other than the above ones. After using the above, we use spermicidal creams, jellies for extra protection. These spermicidal creams and jellies, they kill the sperms. The next point under the category is intrauterine devices, that are IUDs. Now, intrauterine devices, students, are plastic and metal objects that are placed in the uterus through vagina by the doctors and the expert nurses. These intrauterine device, now the name itself tells it, intra means inside the uterus, the device that are inserted inside the uterus. These intrauterine devices are presently available as, the first one is non-medicated IUDs, that is Lippel loops. Second one is copper releasing IUDs, which are CUT, CU7, multilode 375. And the third one is hormone releasing IUDs, that is LNG20 and Progesta Cert. They prevent the fertilization of egg or implantation of the embryo inside the uterus. IUDs जो होती हैं, these increases the phagocytosis of sperms within the uterus, and the copper ions which are released, they alter the biochemical composition of the cervical mucus and thus affects the sperm motility, capacitation and the sperm survival. That means the copper ions which are released by CUT, CU7, multilode 375, these reduces the sperm motility and the sperm becomes less motile, which decreases the chance of fertilization. Copper ions also increase the sperm mortality. The hormone releasing devices increases the viscosity of the cervical mucus, thereby preventing the sperm from the entry in the cervix. They also make the uterus unsuitable or unfit for implantation. IUDs are one of the most widely accepted method of contraception in India, and these are basically for females. IUDs increases the phagocytosis in female reproductive tract. That means the sperms are phagocytosized. The sperms are killed. They increases the killing of sperms. The next category is chemical methods. In chemical method, the first point is spermicidal jellies. Now, spermicidal jellies, the name tells that spermicidal means killing the sperm. The spermicidal jellies contain some chemicals such as lactic acid, KMNO4, citric acid. These chemicals are used to kill the sperm and hence no fertilization occurs. Spermicidal creams, jellies and gels are basically used by females. The second point is hormone combination pills. Hormone combination pill also comes under chemical method. These are the combination pills, and the combination of progesterone and estrogen is taken. The strip has day-wise indication. Normally, we need to begin with the 5th day. That means the intake of this pill is started on the 5th day of menstrual cycle. The hormones, we know that the pill is having a combination of hormone and estrogen. Now, what are the working of this? What is the working of the hormones? The hormone inhibit the secretion of FSH and LH. We all know the function of FSH and LH. So, FSH and LH, the follicular stimulating hormone as well as the luteinizing hormone. And if these FSH and LH are inhibited, then there will be no ovulation. That means ovulation will be stopped. And if there will be no ovulation, that means there will be no fertilization and no embryo formation. The example of hormone pills are Mala D and Saheli. Saheli is the most used pill. Why? We'll discuss it later. Now, progesterone and estrogen, these both are steroid. Steroids can show some adverse effect in the body. Whereas Saheli is a non-steroidal combination pill. The chemical that is used in making this pill is catachromin. Catachromin is a non-steroidal chemical, and because of this it do not show any side effect. Saheli was developed in India only by CDRI, which is the Central Drug Research Institute, Lucknow, and is most widely accepted hormone combination pill because of its non-steroidal character. Let us now study about the injections and the implants, the injectables and the implants. Progesterone alone or in the combination with estrogen can be used by the females as injection or implants under the skin. Injection is given once in every 3 months that releases the hormone slowly and prevents the ovulation. They are convenient and highly effective with no serious side effects. The implants are placed under the skin, or the subcutaneous implants are 6 matchstick-like capsules which contain steroid. They are inserted under the skin of the inner arm above the elbow, and the capsule slowly releases the synthetic progesterone for about 5 years. Okay? Now, as we all know that both the pills as well as the implants, we are using progesterones into it. Now, what is the difference? Why they are kept under different categories? What is the difference between them? The first difference is the process of consumption. That means pills need to be taken daily, whereas the implants are placed once. Okay? Now, as we all know that both secretes hormone, but in the case of pills, they are taken daily, whereas they also work for shorter time duration, whereas implants are inserted once and they work for a longer time duration. So, is it clear? The difference is clear between pills and implants. Now, the last method of contraception is surgical method. Surgical intervention block the gamete transport and thereby prevent the conception. It is called as vasectomy in men and tubectomy in women. Vasectomy involves removing or tying up of vas deferens through a small incision on the scrotum. You can see it in the diagram that we have cut and tied the vas deferens. And in tubectomy, the removal or tying up of fallopian tube is done through a small incision in the abdomen or through the vagina. Can you see it in the diagram? That a small incision is done and the fallopian tube is tied up. These techniques are highly effective for contraception, but their reversibility is doubtful. Their reversibility is very poor. Now, with this, the methods of contraception came to an end. It needs to be mentioned here that selection of suitable contraceptive method and its use should always be undertaken in the consultation with the qualified medical professional. No doubt, the widespread use of these methods have a significant role in checking the uncontrolled growth of population. However, there is possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer. Though not very significant, should not be totally ignored.
We have talked enough about reproductive health, their problems, the strategies, the population explosion, the contraceptive methods. And let us now discuss about amniocentesis. Now, amniocentesis is a prenatal diagnostic technique which is used to detect the defect before the birth of a baby. That means, is the baby carrying any sort of genetic defect or not, chromosomal defect or not. When the baby is still in the womb, when the baby is not born, this method is done. Now, what is the procedure to check the disease? The first one we need is to extract the amniotic fluid. The amniotic fluid is taken out with the help of a minute needle under the observation of ultrasound. Now we need extra medical expert hand for this, because as we know, if the needle touches the fetus, it can create a miserable injury in the fetus. So we need expert hand, and a supervision is done under the ultrasound. Under the guidance of ultrasound, a sterile needle is inserted through the abdominal wall into the amniotic sac, and a very small amount of amniotic fluid is withdrawal. A very small amount, that is 15 ml. The fluid extracted is in very less quantity. In amniotic fluid, the fetal cell are present. Now, as we have discussed earlier in the embryo development, that when the embryo gets developed, some of the cells get detached, and these cells are present or located in the amniotic fluid. These cells are then cultured in vitro. In vitro means outside the body. These cells are grown and are divided in the outer environment, but the environment is same as the condition of the body. These cells are cultured. The tests are performed on the cultured cell. Now, what kind of tests are performed? The test which is performed on the cultured cell is known as CARYOTYPING. CARYOTYPING is basically a technique which tells about the disease, which tells about the chromosomal pattern, so that we can analyze it and detect it.
Let us now learn about karyotyping. What is karyotyping? Karyotyping is a technique in which cell division is arrested in metaphase stage. And why in metaphase stage? Because the chromosomal are clear as well as thick in this stage. We can easily examine them. The chromosomes are stained as well as analyzed to check whether the fetus is having any sort of chemical, metabolic or sex related disorder or not. Karyotyping tells us about all these type of disorders. We can also predict the sex of the baby because we can know about the chromosomes, but this is illegal because it results in the female feticide. Female feticide was practiced earlier in the society, and because of it there was a major sex ratio imbalance which is not for the population. This is the reason why the amniocentesis for sex determination is banned in India. Now students, amniotic fluid, it acts as a protective covering of the embryo which prevent the embryo from the mechanical shocks. So only small amount should be taken out, that is 15 ml, which is sufficient for the test. Now, amniocentesis. Why is there a need to do amniocentesis? Amniocentesis is done to check whether the embryo or whether the child is having any congenital defect or not. 3 types of congenital defect we have discussed: chromosomal defect, metabolic defect and sex linked disorder. First, let's talk about chromosomal defect. We all know that chromosomes are present in pairs. If there is a decrease or increase in the number of chromosome pair, this is known as chromosomal defects. That means other than 2. If 3 are present or if only 1 is present, then this is a chromosomal disorder. For example, what happened in Down syndrome? In Down syndrome, there is a trisomy of 21st chromosome. That means three chromosomes are present. 3 21st chromosomes are present in the body, which creates a syndrome, and this syndrome was named as Down syndrome. The next point is sex chromosomal disorder. Now students, we all know that two X chromosomes give rise to a girl child and one X and one Y give rise to a male child. What if there is one X and no other chromosome? And what if there is 2X and 1Y? This is sex chromosome related disorder. The X0 is named as Turner syndrome and XXY is named as Klinefelter syndrome. Metabolic disorder is the another category, which is an enzyme related disorder. Example, phenylketonuria. If there is an absence of phenylketonuria, some metabolic chemicals are missing. With this ultimately leads to some sort of syndrome, which is also considered as a congenital disorder. We'll discuss more about these type of syndromes later in chapter number 5, which is genetics. So students, MTP, it is the last point of part first, that is medical termination of pregnancy. Now what do you mean by medical termination of pregnancy? Why is medical termination of pregnancy done? So students, if by chance there is any deformity which is seen in the fetus, only in this situation medical termination is allowed. MTP is done only if the major deformity is seen in the fetus after amniocentesis, which can lead to be disastrous for both mother as well as the baby. So termination of pregnancy or abortion before the completion of full term is called as medical termination of pregnancy or induced abortion, and it is done only if any sort of deformity or disorder is observed in the fetus. MTP can be done only till the 12th week of pregnancy. Otherwise, it can be dangerous and hazardous for the females, the mothers. MTP are done only when it is recommended by doctors. Otherwise, MTP is considered as illegal. Only if doctors assist, then only MTP is considered as legal. The government of India legalized the MTP, that is the medical termination of pregnancy, got its legalized license in the year 1971 with some strict provisions and rules to prevent its misuse.